Meanwhile, Discovery Health says they're working closely with key stakeholders to support the National Department of Health in its procurement of the COVID-19 vaccine. The medical aid scheme says they've allocated funding for all of its members to receive the vaccine. For more, we're joined by Ronald Whelan, Chief Commercial Officer at Discovery Health. Thank you very much for your time today. So in that recent tweet, Discovery said that funding has been set aside for its members to get the COVID-19 vaccine. But does that mean that all Discovery members will get the vaccine, whether they fall within government's priority criteria or not?
Well, firstly, thank you for having us. Much appreciated. Great to be on the show. So firstly, you're right. Discovery has allocated your funding for vaccinating all members of the scheme. In fact, we got board approval a good 6 weeks ago already on that. Secondly, it will be for all members of the medical scheme over time, but as Professor Shube mentioned, we need to follow your strict prioritization criteria. They're obviously members of the scheme who are at higher risk than other members of the scheme. So, as Professor Shube mentioned, firstly, essential frontline healthcare workers. Secondly, your people at risk of more severe manifestation of the disease, and then the broader-based members.
Right, so are you negotiating directly with vaccine manufacturers to secure additional doses?
So we're working closely with both private sector partners as well as government partners to procure vaccine for all of South Africa. I think it's an important principle for us in that the vaccine is only really effective if we vaccinate the whole of South Africa. So we need to achieve herd immunity across South Africa. So we're working hand in hand alongside our government and private sector partners to secure vaccine. Those discussions are extensive and across the globe with your various manufacturers across the globe, trying to understand what are the timelines towards your manufacture and then your supply of these vaccines.
Where has the funding been allocated from?
I beg your pardon?
Where has the funding for these doses been allocated from?
Well, so the medical scheme will fund for Discovery Health medical scheme members. As I mentioned, the board has already approved that funding. So the funding is available, is allocated for vaccines in 2021. So any member of Discovery Health medical scheme will have funding available for the vaccine. And that includes both the actual vial for the vaccine as well as the administration of the vaccine. You've got to remember that it's both administration and the actual product.
And do you have a practical working model in place? Do you know how it's going to be rolled out practically, or will that develop once the timelines have been secured?
Well, I think South Africa is in a very fortunate position in a number of regards. So firstly, it has an extensive vaccine program, particularly around children up to the age of 12 or 13. And that's been running for many, many years. Secondly, South Africa's got very good healthcare infrastructure, both in the public sector as well as in the private sector. And we would certainly leverage the private sector channels for vaccine provision from a Discovery Health medical scheme perspective. And that would include retail pharmacies, GP practices. And we're even exploring models such as mass vaccination campaigns, similar to what Germany has rolled out.
Some would argue that members of Discovery Health are more fortunate South Africans. They're more affluent South Africans who can afford private medical care. That very idea falls outside the equitable distribution of a vaccine like this. What are your feelings about that?
Well, we're fully committed to equitable distribution of vaccines, and that's why I said we're working alongside both government and private sector partners to secure a vaccine for all of South Africa. It's not only for Discovery Health medical scheme members, it's for all of South Africa, and that's a really important point for us, both socially as well as clinically. So, as I mentioned before, we need herd immunity across the country. You're right. We do have a population that perhaps can afford more extensive healthcare services. But what we're aiming to do is leverage that buying power to get a good commercial arrangements with manufacturers across the globe, so that we can procure vaccines for all of South Africa.
Well, thank you very much for taking the time to speak to us. That was Ronald Whelan, Chief Commercial Officer at Discovery Health.